Hi, this is Stephen, and in this video we'll talk about how left ventricular strain can be used to assess left ventricular systolic function. What is strain? Well, I've drawn the apical four-chamber view of the heart when it's filling up with blood in diastole, and let me also draw in systole. So in systole we would see the left atrium, and I'm going to exaggerate things a little bit, but we've got our left ventricle that will be all thickened here. And then over here, you've got your right ventricle, right atrium. And again, I'm exaggerating this to illustrate this concept of strain. But strain, you basically look at two little points. This is where those 2 points would be in diastole. And then during systole, those points may actually come closer together. And what the machine does for us is it basically calculates the change in length divided by the normalized by the total length, and that concept is equal to strain. And I've shown longitudinal strain. Now I could also, if I picked these 2 points here, and we see how those get farther apart, that would be looking at radial strain. In fact, let me draw the left ventricle as a shape right there. We could look at our longitudinal strain. How much does the length, the delta L over the total L? We could look at our radial strain. This would be radial. Let's label this as longitudinal. Longitudinal. Or we could even look at torsion. And the heart actually kind of rings on itself, so it goes in different dimensions at the base versus apex. But you can look at torsional strain. Torsional strain. And why would we do this? Well, strain can actually be quite useful. It can be an early warning for many conditions before the ejection fraction drops. We'll list those out in a second. I want to make one other point first, which is you may remember how we can segment the heart into, let's come down over here, into various segments. So I'll quickly draw those for us again here. In fact, let me make this a little bit bigger. I'm going to add a segment on the outside. So this is all your left ventricle that I'm segmenting, and then you've got your right ventricle off to the side. And there's 16 and 17 segment models. I'm doing the 17 segment model here. And what we can do, so for example here, from our apical four-chamber view, we would look at these different segments. You've got your basal segments, then you've got your mid, then you've got your apical segments, and then you'd have a segment right at the apex itself. And then you can look at your two-chamber, your three-chamber views. In fact, let me show how those would. So your two-chamber would be looking right here. This would be your two-chamber view. The four-chamber view that I drew would be looking something like this. And then your three-chamber view would fill in these segments over here. And what you can do, your echo machine or your software can actually calculate the strain for each of these segments and then give you a plot where it shows how the strain of your heart is in each of these areas. And so we will focus on global longitudinal strain. Global longitudinal strain, or GLS. And the absolute value of GLS should be greater than 20%. What does that mean? If you look back at these green dots I drew, right? They're far here, they come close here. If you do the change in length divided by the total length, that delta L over L should be 20% or more. If it's not shrinking, if the strain is not, the absolute value of strain is not 20% or more, let's say it's 15% or 10%, that means that your ventricle is not moving as much as it should, and that can be an early warning before your ejection fraction drops. What are some of the specific conditions that it can be helpful for? So I'll say it's a warning. Should be greater than 20%. We'll say the absolute value, if it's less than 20%, that is a warning. What could you be dealing with? Well, you could be dealing with an infiltrative disease like amyloid, or like glycogen storage disorders. Could be something more common, like it could just be due to hypertension or diabetes or coronary artery disease. If you have a transplant patient, it could be a warning for rejection. You have a patient who is on chemotherapy, maybe it's because of adriamycin toxicity. And you can also see abnormal patterns with some of the cardiomyopathies, like hypertrophic obstructive cardiomyopathy, with a dilated cardiomyopathy. And so in any of these cases, you may see an abnormality in the strain. Let's say the strain went from negative 20% to negative 15% before the ejection fraction drops. So it can give you an early warning so that you can act on it sooner. And there's particular patterns. I'll just draw a couple of the patterns down here for your reference. So this will be looking at the left ventricle and then right ventricle off to the side, left ventricle and right ventricle, LV, RV, LV, RV. So the first pattern I'll draw, this would be all normal. If the whole thing is red, usually our convention is that red would be a good amount of strain or good movement of the heart. What if you see that it's just, we call this the cherry on the top, normal movement at the cardiac apex, but the base is not moving like it should? That would be worrying for amyloid. What if you see that it is moving well, but not really in the septum, but it's moving well everywhere else? Well, then we would worry about HoCM. Is there something wrong with the septum? Why it's not causing it to not move so well? What if we see instead that it is moving everywhere well, except it's not really moving so well out near the pericardium? Well, then we'd wonder, could there be some kind of a constrictive problem? Could there be some constriction going on? Something with the pericardium? And then this one, of course, here would be normal. So again, strain and the strain pattern can be very helpful to give us a warning that something may be abnormal before the ejection fraction becomes normal. And global longitudinal strain is the one that we most commonly use, although you can look at radial and torsional strain. And global longitudinal strain, negative 20%, or the absolute value should be at least 20%. When it's less than that, let's say negative 15%, negative 10%, even if the ejection fraction is normal, that can be a warning that there's something abnormal about this heart.